Heart disease is the #1 cause of death in the United States for both men and women. This year alone, almost 800,000 Americans will have a heart attack.
We know that proper nutrition is an important key to keeping the heart healthy. So today on Health Talk, we'll focus on tips to make your diet good for your heart.
Join us and our guest, a nutrition expert, and feed your heart some love.
We're up next. Hello, I'm Dr. Andrea Peterson.
I'm sorry, and I'm Dr. Eric Mazer. Joining us today is someone with important advice to help us live healthy lives, Barbara Schmidt. Barbara's a nutrition expert, frequent guest on Health Talk, and the Nutrition Lifestyle Program Specialist at Norwalk Hospital.
Welcome back.
Oh, thank you.
So great to have you here.
It's so nice to be here. Thank you.
So today we're talking about heart-healthy diet.
Right.
Now let me just generally, is a heart-healthy diet different than any other kind of diet that's good for you?
Yes, it is. I mean, we want to primarily be on like a Mediterranean diet, which is focused more on plant-based foods. So your plate should be, half your plate should be, plant foods rather than animal products.
And how is that, what does that do for your heart?
Well, first off, we want to eat a low saturated fat diet. So animal products are higher in saturated fats. So when it comes to protein, your saturated fats would be any fat that is solid at room temperature, like a stick of butter, okay? So, or it would be the fat that's on a piece of meat, or the skin on a chicken. This is saturated fat. You want to stay away from that, and saturated fats will raise your LDL, the artery clogging cholesterol.
The LDL is the bad cholesterol.
It's the bad cholesterol. We want to try to raise our good cholesterol, which is the HDL, which basically I call it nature's rotor-rooter. It cleans out your arteries. So the only way really to raise that is through exercise. So I always tell my patients, exercise is your medicine. So even though you may not want to do it, you have to do it because you're cleaning out your arteries. But when it comes to food, getting back to the proteins, we want to focus more on fish. And in particular, I like my deep cold water fish, something like salmon or tuna, mackerel, sardines.
Can I ask you a question about that? I hear a lot about mercury in fish like that. And do people, is there enough mercury contamination to make you worry about that if you're eating a high fish, cold water fish diet?
Yeah, well, if you're pregnant, they do advise women that are pregnant to be very, to monitor that type of fish that they're eating, and also young children. So yes, I have heard of people who eat sushi every day for lunch and for dinner. In fact, I had a client who was eating it like that and did have mercury poisoning from all the sushi. So you do need to watch, but the health benefits of the deep cold water fish with those omega-3 fatty acids outweighs the risk, is the theory that the American Heart Association says.
Maybe you can talk a little bit more about those omega-3s because they're really important.
They really are. Omega-3s, what they do is they reduce the systemic inflammation throughout your body. And if inflammation is caused by any kind of disease, or if you have high blood pressure, or if you have diabetes, or if you're overweight, you have inflammation. And if you have inflammation, that's where the cholesterol is going to stick. I always say, in a way, cholesterol is kind of like nature's Band-Aids. It's trying to fix it so it's not inflamed. So the omega-3s will reduce that inflammation so the cholesterol won't stick, and it also helps to lower your triglycerides. And triglycerides are the fat that's in your body. So it's also the fat that's accumulated on your body and the fat that's inside your blood.
Well, Madison Avenue would have us believe that you can get all the omegas-3s that you want in a couple of pills that you take every morning.
Right. Well,
talk a little about maybe omega-3 supplementation. Can that replace a Mediterranean diet?
Well, the recommendation is when it comes to fish, we want to have fish at least 2 to 4 times a week, at least 2 to 4 times a week. But many times I have patients and clients that do not like fish. So if that's the case, then I do recommend that they have a supplement. But you have to read the label because it's very deceptive. I like fish oil because fish oil has DHA, and DHA is good for your brain. Where flax seeds has omega-3 but doesn't have the DHA. But does become confusing when you buy those supplements, because it will say 1,200 milligrams of fish oil. But then you have to read the fine print, and then you have to see how much omega-3s are in there. So the recommendation is 600 to 900 milligrams of omega-3s. So I'm in cardiac rehab, and that's what I do recommend to my patients. But I always say check with your doctor, because omega-3s are a blood thinner. And if you're on other medications that are blood thinner, the doctor needs to know about this before you start taking a supplement.
So you're not necessarily against the fish oil supplements?
No, absolutely not. In fact, I take one myself. But I recommend don't spend a lot of money. Go to Costco. I buy the Kirkland brand. Your body doesn't know if you paid $500 for that vitamin pill or $5.
I've seen things like krill oil and other stuff out there that's advertised.
Well, I've looked at the krill oil, and to be honest, the krill oil doesn't have as much of the omega-3, so you have to eat more of the krill oil pills to be equivalent to this one pill that they have, actually, that Kirkland makes.
So I think there's actually a good message there that is quite a broad one, and we've talked about this on the show and other times. Read the labels in the pharmacy.
Yes.
No, don't use name brands. Don't take the front label, which they're using to try to sell the drug.
Right.
But read the label. And what they should be looking for is true omega-3 fatty acids.
Right. You want to see how many milligrams of omega-3s are in the pill.
And how much do we want to see on that?
600 to 900 milligrams.
Per pill? Or
per pill. That would be one pill. If you have one at home, let's say that only has 300 milligrams of omega-3s, then take two. And it doesn't matter if you have one in the morning and one at night or both together.
Now, how does that compare to a serving of cold water fish?
Well, that's a good question. Actually sardines have the greatest amount of omega-3s, where a 3-ounce piece of salmon, and this is 3 ounces. So I always say a deck of cards is a 3-ounce serving. And as far as I know, I think a 3-ounce serving of salmon has about 100 milligrams of omega-3s, where the sardines are more than that, or maybe about 90. And sardines are like 170.
But of course, eating the fish as opposed to taking a pill also gets you valuable protein.
Well, let's face it. This is what I always say. If God wanted us just to eat pills, there'd be trees out there with vitamin pills. You need to eat the food. And you need to eat a variety and a balanced diet. So we just touched on the protein, but we need to eat fruits and vegetables and breads and cereals. And I like whole grains, things that are high in fiber. And it's important.
And why? To explain to people why you think that's better than the white bread or the nice white pasta.
Well, because fiber, when you talk about fiber, there's two types. There's your soluble fiber and your insoluble fiber. Your soluble fiber are found in your fruits, your vegetables, and your beans, your legumes. The soluble fibers are the agars, the pectins, the gums that will bind with cholesterol and prevent your body from absorbing them, and will bind with any toxin that's in your body as well. The insoluble fiber is found in grains, and primarily wheat, whole wheat, 100% whole wheat. And it's the skin, it's on a kernel of wheat, the bran, or the skin on a baked potato or an apple. And it literally acts like a toothbrush and cleans your intestines out. So things going in are going out. And so if I have cholesterol and toxins in my system, I'm not going to absorb it. And it keeps your gut healthy, which is we could do another show on the gut biome. So, but keeping your gut healthy. But we need fiber to keep us regular.
How about in terms of appetite control and the
absolutely.
Because I think there's a lot to be said for high fiber foods,
right, and
making you feel more satisfied more easily than the low.
Okay, so the patients that I see in cardiac rehab usually need to reduce. Okay, so we need to lose weight. So that's always a focus. And the thing about fiber is, fiber will fill the void and fills you up, so you're not going to be as hungry. Also, fiber takes more energy to digest. So I say that when you eat something like a high fiber piece of bread, trapped inside here is the simple sugars that my body needs so it can absorb it. When I eat this high fiber piece of bread, my body's like a little food processor. I'm using 25% of its calories to digest it. So if this was a 100-calorie piece of bread, my body's only going to realize 75 calories. If I eat white bread, a 100-calorie piece of white bread, suck that in, I absorb it, doesn't take any energy. It's been processed at the mill. You want to be the food processor.
Can you talk about that a little bit in terms of vegetables and fruits and juice?
Okay, so I don't like juice. I want you to eat the whole food. Okay, so I mean, of course, for some patients that aren't eating enough fruits and vegetables, then okay, juice is fine. If they are nutritionally compromised, like a cancer patient. But I like the whole food because this has fiber, this does not. When I drink, this is both of these, this is a cup of juice, which is 4 ounces, and this is a small orange, I call it a clementine, because our portions, if you see, they're so small. So this is 65 calories, and so does this. When I drink the orange juice, I absorb it right away. My blood sugars rise. When I have the orange, I have to be the juicer. I use 25% of its calories to digest it, so I only get like 45 calories. So you want to eat foods in their natural packaging. So I don't really like juices, except if it's something like a cancer patient. So I usually tell people to avoid juice as much as possible. I wanted to say, people always get so hung up on cholesterol. And studies show that it's not the cholesterol that's raising our blood cholesterol levels.
It's not the cholesterol that you eat that increases
right.
your blood cholesterol.
Because one thing people don't understand is that we make cholesterol. Our livers make cholesterol. And we need cholesterol to live, to make hormones, to make bile salts, you all know that. And your blood cholesterol is a combination of what your body is genetically making from your history, your family history, as well as what you take in your diet and your lifestyle. So, but we thought that eating too much cholesterol was what was increasing our blood cholesterol. So we know now it's not the cholesterol, it's the saturated fats. And those are the fats that are solid at room temperature, the butter, the fat on the steak.
I thought it was also the total calories that affected it, no?
What, the cholesterol?
Yeah.
Not the calories, but the fat on your body. If you're eating too much, then you're going to be overweight. But also anything that's processed. I don't like trans fats. I tell trans fats are fats that the food manufacturers have developed because, let's say, you know, the premium saltine cracker, I shouldn't say the brand, but crackers and cookies that are on the shelves. In order to make them crispy and flaky, they need a fat that is saturated. So like butter, you know how Christmas cookies are nice and crispy.
Delicious.
Okay, so butter doesn't have a long shelf life. So they'll use fats like your tropical oils, like palm oil and coconut oil. And they also use trans fats. These are these hydrogenated fats. It's the shortening, it's the stick margarine.
And I'm going to have to cut you off because we've run out of time for this.
But we want to stay away from those. I say
stay away from trans
They're
fats.
bad.
Yes.
We're just going to have you back to talk more about this because we just totally run out of time. We want to thank our guest, Barbara Schmidt, for joining us on Health Talk.
We look forward to receiving your questions and comments. Please email us at healthtalk@wchn.org.
Thanks for watching, and eat Mediterranean.